My name is Gary Harper. I'm a professor of health behavior and health education here in the School of Public Health. I've been working in various different communities with young gay and bisexual men throughout the city of Chicago for many years. The project I've been working on in Chicago is a grant funded through the National Institute of Mental Health, where we've been developing an HIV prevention intervention for Black, gay, and bisexual young men ages 16 to 21.
The way we structured it, it has 4 individual sessions, or 4 sessions where we meet as a group, 6 to 8 guys in a group, and then 2 facilitators.
I feel like this is finally something that addresses everything the young people need. So it is a bit HIV focused, but it has my experiences in there. It actually has our success stories in there.
There's just this spark that happens behind someone's eyes. We can tell they've learned a new bit of information that has in some way changed their processing.
We have a youth action board. So the youth action board are the young men that have been with us since the very beginning of the project. And they're all young Black, gay, and bisexual men. So they helped us to develop the intervention. And then when we got to the point of implementing it, the 5 guys I mentioned were all able to serve as facilitators in the project.
I started going to the youth action board meetings and learning more about the project and slowly getting more and more involved with the research process.
I've been in my job for going on 3 years. I've been with this project going on 4 years, and I just love it.
I really wanted guys who cared about the community, who had a passion, who wanted to make a difference, and that's really what we looked for, and it worked.
Those meetings were magic. Like and Omar would tell you, we came together, we would just chat. Half the time we would kind of play the horse around, but when it came time for business, we got down to business.
Dr. Harper has a great personality. It kind of just ropes you right in, and the fact that he was willing to listen, to me or to the other youth action board members really showed us that he was serious about the work and that he wanted to make a difference.
On whatever it is you're trying to accomplish, if it's a certain race or type of people, that you're not a part of, it doesn't mean that you can't do the work, but just do your research and make sure you know your facts.
When we think about working with communities, we have to take the pulse of the community. We can't sort of say, I know all this, I have this many years of experience. That's great, but they also have experience and they live that.
When we submitted the grant to talk about critical consciousness, people weren't really clear what this was because it isn't a concept that's been used a lot or much at all in HIV prevention.
With critical consciousness, I think with awakening that, it kind of gives them a space to think for themselves or maybe look at things a different way.
For me, it was really a dream study because I'd been working with young Black gay men in the community in Chicago for so many years, and I kept hearing the same stories over and over again about all of the different issues that they had to deal with and juggle.
Being an adolescent or a young adult, I really didn't have those safe spaces or even an avenue where you could talk about being gay. I don't even think there was a word for it, or it wasn't publicly discussed. So to have a space where people can talk about their gay identities, I think is wonderful.
We're nearing the end of data collection, so at that point we'll be able to start to look at the data. Now we're going to be following them up to 6 months after the intervention. So we won't really know about long-term effects until 6 months after. But anecdotally, yeah, we've seen already that a lot of the young men from just being in the group together have made connections.
There are so many young people like me who were in the same position, and I'm the one that's like, hey, you should know about this. I'm going to tell you if no one else has, and it feels really good. It honestly does.
I think a lot of times, especially in public health work, and especially as we move to a more biomedical focus, I think we lose a lot of the human component. And I just think that this is a rich opportunity to actually hear from people.
That's the exciting thing for me about doing real community-based participatory research is that it's not just about the study, but it's about the long-lasting effects and the changes that we're going to see for years to come in the community.